Critical Care Registered Nurse, Neonatal, Practice Test 2026-25 Real Questions. Question 1. A neonate with respiratory distress syndrome, RDS, is receiving surfactant. Which assessment finding indicates a positive response? Increased PaCO2, decreased FiO2 requirements, decreased breath sounds, increased heart rate. Surfactant reduces surface tension in the alveoli, improving oxygenation and decreasing the need for supplemental oxygen, FiO2. Question 2. Which medication is the first-line treatment for a neonate with symptomatic persistent pulmonary hypertension of the newborn, PPHN? Inhaled nitric oxide, ENO. Intravenous dopamine. Intramuscular penicillin. Oral aspirin. Inhaled nitric oxide is a selective pulmonary vasodilator that helps reduce pulmonary artery pressure without systemic effects. Question 3. A preterm infant exhibits abdominal distension, bloody stools, and pneumatosis intestinalis on X-ray. What is the priority nursing intervention? Start oral feeds. Place the infant NPO. Administer rectal suppositories. Increase fluid rate. These are classic signs of necrotizing enterocolitis, NEC. The infant must be made NPO to rest the gut and prevent perforation. Question 4. In the CCRN neonatal exam, professional caring and ethical practice accounts for what percentage of the questions? 10%, 20%, 5%, 50%. According to the CCRN blueprint, 20% of the exam covers professional caring and ethical practice. Question 5. Which sign is most indicative of neonatal sepsis? Temperature instability, hyperactivity, increased appetite, ruddy skin color. Neonates often present with temperature instability, hypo or hyperthermia, as an early sign of infection, along with lethargy and poor feeding. Question 6. A neonate with a transposition of the great arteries, TGA, requires which medication to keep the ductus arteriosus open? Indomethacin, prostaglandin E1, furosemide, digoxin. Prostaglandin E1 is used to maintain ductal patency in ductal-dependent cyanotic heart disease to ensure mixing of oxygenated and deoxygenated blood. Question 7. What is the primary goal of developmental care in the NICU? To promote rapid weight gain, to minimize stress and support neurodevelopment, to ensure the infant sleeps 20 hours a day, to prevent all parental contact. Developmental care focuses on mimicking the intrauterine environment to reduce stress and support brain development. Question 8. A neonate born at 28 weeks gestation is at high risk for which complication due to fragile germinal matrix vessels? Intraventricular hemorrhage, IVH, hyperbilirubinemia, hip dysplasia, cleft palate. Premature infants have a highly vascularized germinal matrix that is prone to bleeding with fluctuations in blood pressure. Question 9. Which electrolyte imbalance is most commonly associated with a neonate receiving high-dose diuretics for BPD? Hyperkalemia, hypokalemia, hypernatremia, hypocalcemia. Loop diuretics like furosemide often cause potassium loss, leading to hypokalemia. Question 10. What is the standard treatment for a neonate with a total bilirubin level of 18 mg/dl at 48 hours of age? Increased water intake, phototherapy, exchange transfusion, antibiotic therapy. Phototherapy is the first-line treatment to convert bilirubin into a water-soluble form for excretion. Question 11. The synergy model for patient care is the framework for which exam? NCLEX, CCRN, CNA, MCAT. The CCRN exam is based on the AACN synergy model, which matches nurse competencies with patient needs. Question 12. A neonate is diagnosed with gastroschisis. What is the immediate nursing action at birth? Feed the infant. Cover the defect with sterile, saline-soaked gauze and plastic wrap. Apply a dry dressing. Place the infant in a prone position. Keeping the exposed bowel moist and warm is critical to prevent infection and fluid loss. Question 13. Which assessment is most critical for a neonate with a suspected diaphragmatic hernia? Bowel sounds in the chest, abdominal girth, rooting reflex, weight. A scaphoid abdomen and bowel sounds in the chest cavity are hallmark signs of a diaphragmatic hernia. Question 14. A neutral thermal environment (NTE) is maintained in the NICU to prevent which condition? Cold stress, hyperthermia, dehydration, sunburn. NTE allows the neonate to maintain a normal body temperature with minimal oxygen and calorie consumption. Question 15. What is the antidote for neonatal opioid withdrawal, NAS, if the mother used heroin during pregnancy? Naloxone, morphine, vitamin K, glucose. While naloxone reverses acute overdose, NAS, withdrawal, is managed with weaned doses of opioids like morphine or methadone. Question 16. A neonate with tetralogy of Fallot is having a TET spell. What is the best position to place the infant in? Supine, knee chest, Trendelenburg, prone. The knee chest position increases systemic vascular resistance, which helps shunt blood into the pulmonary system. Question 17. Which vitamin is administered to all neonates shortly after birth to prevent hemorrhagic disease of the newborn? Vitamin C, vitamin K, vitamin D, vitamin B12. Neonates are born with low vitamin K levels, which are necessary for the synthesis of clotting factors. Question 18. A neonate's APGAR score at 1 minute is 3. What is the immediate priority? Call the parents. Resuscitation/positive pressure ventilation. Dry and wrap the baby. Check the blood glucose. A score of 3 indicates severe distress and requires immediate resuscitative efforts. Question 19. Which type of isolation is required for a neonate with suspected RSV? Contact and droplet. Airborne. Protective. RSV is primarily spread through direct contact and large droplets. Question 20. What is the significance of a widening pulse pressure in a preterm neonate? Normal finding. Patent ductus arteriosus, PDA. Coarctation of the aorta. Sepsis. A PDA causes a runoff of blood from the aorta to the pulmonary artery during diastole, leading to a low diastolic pressure and a wide pulse pressure.